The views expressed on the Making It Matter podcast are that of Gunnar Esiason, Julia Ray, and guests, and not necessarily those of the Boomer Esiason Foundation. Nothing in the Making It Matter podcast should be considered medical advice. Such advice can only be given by a physician who is experienced with cystic fibrosis. The Boomer Esiason Foundation, Gunnar Esiason, Julia Ray, and guests cannot be held responsible for any damage which may result from using the information on this podcast without the permission of your medical doctor. You're listening to the Making It Matter podcast with Gunnar Esiason and Julia Ray, presented by the Boomer Esiason Foundation and GunnarEsiason.com.
Hey there, it's Gunnar Esiason, and thanks for joining Julia and I for episode 20 of the Making It Matter podcast series, Julia and Gunnar's Mailbox.
Hi, everyone. Making It Matter is a weekly podcast presented by the Boomer Esiason Foundation and GunnarEsiason.com, highlighting the challenges that people with CF face and the people who face them.
Since Julia and I both have cystic fibrosis, we're made compliant with the National Cystic Fibrosis Guideline regarding patient interaction and cross-infection. This podcast was made possible by Novartis, Vertex Pharmaceuticals, and the Digital Credit Union. So big thanks to them for always supporting the Boomer Esiason Foundation educational programs. So this week between Christmas and New Year's is always a little bit crazy. So Julie and I want to change it up a bit and go through as many questions that we have gotten as possible in the time allowed to us. So here we go. We're going to go with the first ever edition of the Gunnar and Julia Mailbox. Our first question was in response to our last podcast about the psychological impact of hospital stays. If you haven't listened to that one, it's probably a pretty good one to listen to. A lot of good information there. But anyways, a CF mom asked, where does someone turn when they are 30 and have extreme anxiety?
Yeah, I think that mental health is a huge component of cystic fibrosis, and so much so that they're actually requiring a mental health screening now for young adults with CF that I was actually just handed at my last clinic. And I think the best thing to do when faced with anxiety or depression is to, first acknowledge those feelings for yourself and not live in shame or fear of those feelings. Like, they're completely valid and you have every right to be feeling that way. And then once you kind of accept those, reaching out and leaning on others is so important. I've had personal instances where I have faced those issues, and I know as soon as I opened up and kind of surrendered to those feelings, it was exponentially better for me and changed the outcome significantly.
Yeah, no, I definitely think talking about it is probably the first place to start. This is a pretty, there's a lot of layers here. I look at myself, I know I have quite a bit of anxiety when I'm going in for a procedure, or even when I'm getting a PICC line to this day. I still have a little bit of anxiety before I go in. Even when I'm getting a blood test or something, I sort of do feel, the butterflies in the basket, so to speak. But as far as where to turn when it comes to the clinic, the CF team is definitely geared to help. Like you speak, I know you're talking about the mental health screening. I actually have not gotten that yet, for whatever reason. It actually just feels like someone finally asked me how I was coping with CF within the past 6 months. It's the first time someone ever asked me, "Oh, how are you handling this, Gunnar?" And I'm like, I think I'm doing all right. But no, I haven't.
25 years later.
Yes, right. I haven't gotten the mental health screening yet. I'm sure I'll get that. Oh, my computer's. I'm sure I'll get that soon. But the best person to ask, I think, is probably the social worker. The social worker a lot of times is definitely trained as a therapist, in many cases at least. And that person's also there to really help navigate some of the stresses that go along with CF.
Yeah, and if you need to talk to another professional, the social worker can certainly point you in that direction. And I don't think that's something to feel ashamed about either. I think, speaking openly about mental health is something our nation is trying to do a whole lot better on anyway. And I think in the CF community, we should be doing that as well, and accepting that it's a part of the journey and helping those that need it, for sure.
Yeah, no, I definitely agree. I think most cystic fibrosis clinics are definitely equipped, at least major CF clinics, are equipped with the social worker and the full team, the dietitian, the doctor, obviously, the nurse practitioner, and all the different moving pieces of the general CF clinic. And I do think that the social worker is definitely the person to ask, but then also the doctor, too, ultimately. That they can always point you in the direction of somewhere where to go and what to do, because the way it's been described to me is people who have gone through therapy or psychiatric evaluation or mental health help or whatever it may be. It's got to be one of those things that I think needs to be accessible.
Yes.
As far as people with CF, we have so many things that we're constantly doing to take care of ourselves. In a lot of ways, it feels like we're just adding on another layer of care, and in a lot of ways, it's really a pain in the ass, or it can be. Just to feel like you're adding on another thing. So
it's easy to neglect too.
Yeah,
because
it definitely is, because you
it's
can't
hard.
see it. Well, you can't see it.
Yeah,
It's not something you can see. So,
and I think it's hard to admit it to yourself too. Like,
oh no, it definitely is.
that.
It definitely takes a degree of strength, to recognize that you may not be where you need to be. And I like I said, I've never received any sort of mental health screening. So for all I know, I'm all screwed up. But I don't really know. I think I'm okay. But I do think that it is something that it needs to continue to be talked about. It needs to be, I think, normalized as far as CF care. Because when we look at CF care, we look at the therapies, the treatments, the meds, the enzymes, all these different things. And it's just piling on and on and on and on. And for people like me, we have the feeding tube. It's just another thing to do. And then this is just a whole other layer that's there. And whether or not we want to accept that as part of the disease is, I think, just another step.
Yeah, and I think that's the other thing too, is like how much of the anxiety and depression could be just life, and then how is it affected again by CF? I think adolescence and then young adulthood is hard.
And it's hard. It's hard, but it's also probably exponentially harder for a 19-year-old kid with CF to hear somebody talk about life expectancy of being 38 years old. At 19 years old, it's like, oh my God, I'm halfway through my life already. That's as ridiculous as that sounds. That's people talk about that sort of thing. Which is why I feel so strongly about the misuse of the life expectancy stat when it's thrown around like it's just, I wrote a blog about this about a month ago, and I do feel like that the life expectancy stat and the way that it's presented is, well, it's a great marker for success and things as far as the research and technology and fundraising has come. But for people with CF, it's just like,
yeah, how do you unpack that?
Yeah,
you can't. It's like, I completely agree. And I think talking openly and talking to your team, that's going to be the best way to get to a solution and help you kind of navigate those feelings and kind of come around full circle to feeling good about, where you are.
Exactly. So I think the short answer for this question is, where does someone turn when they're, a growing adult and they have extreme anxiety about CF and the way they're living? And I think ultimately the person, you have to start the conversation with someone at the clinic. You have to start this conversation with the social worker, your doctor, someone at the clinic that can guide you in the correct direction to get you help.
Yep. Agreed.
So the second question comes from a YouTube subscriber. This one's a little bit of a question out of left field. My question to you, Gunnar, is, while not mattering as a child, but as a young man, has a physician ever mentioned about facial hair, beards, mustaches, harboring germs or bacteria so close to the airways?
Speaking of mustaches.
Yes, speaking of mustaches, I actually happen to have one. I forgot that I even had it when we started recording. So here we are now talking about my mustache. No one has ever said anything to me about my facial hair. Has anyone said anything to you about your facial hair?
No,
Never?
Thankfully.
Never? No, that's a kind of a crazy question. I can't say I have ever considered that. Ever.
Yeah, I was gonna say, my brother with CF has a full beard, long, and that's never come up in conversation either. So
Actually,
Interesting. I mean, like, actually something to think about.
but is it? I mean, here's a funny anecdote. I was a sophomore in college, and I got pretty sick. I had who knows what I had. I had some sort of virus or whatever. So I had to go on IV antibiotics, and I had a lot of mucus and stuff like that. So the doctor decided that she wanted to use IV steroids, and this was the first time I'd ever used IV steroids. And let me tell you, IV steroids are amazing. They make you feel like a brand new person after 5 minutes.
Immediately.
It was unreal. It was absolutely unreal. But they only use them when they're supposed to be used. So I left college. I was at BC. I left BC to go back to New York to start IVs. That was the plan when I was younger in college. My freshman, sophomore years, I would go back home for a few days, start the IV, and then come back to Boston probably 3 or 4 days into the IV and take the rest on myself. So I always had this terrible reputation of growing a patchy beard. Like I was growing like a patchy, like gross, gangly beard. And I go home, I use the IV steroids, I come back, and my friends are like, "Oh my God, Gunnar, what happened to your beard? It looks awesome." And I was like, "That's probably from the steroids." Who knows if that's what it was? But I came back, and I was finally able to grow a full, thick beard. And my friends were so jealous because they also were in that stage in life where they were growing patchy, gangly beards. So there is a perk to having CF. That might be one of them. However, not a great perk, but it was one. But
perhaps not for the females with CF.
yeah. Have I ever thought about whether or not that beard, or in this case, my Chuck Norris mustache, does it hold bacteria? I have no idea. It's a great question. Thank you for the question. But no, I've never thought twice about it. I do think twice about it when my mom gets angry at me. She still gets. I'm 25, and she still gets really upset.
It's not a fan.
So there's another anecdote about the reason I have the mustache actually is we had a Christmas party. I was going to a Christmas party probably about 5-6 days, like Friday before Christmas, and I knew there was gonna be pictures taken, so I actually shaved a Fu Manchu. And my mom saw me, and she was like, "Gunnar, we're having friends over for Christmas. You can't have that. You have to shave the Fu Manchu." So I did. Yeah. I shaved the Fu Manchu by shaving the handlebars off and leaving the mustache. Obviously.
Typical son move.
Yes. Living in my teenage years still.
Oh.
So.
Rebel.
Here's the deal. Listen, if you're listening to this podcast and you have an answer for us as far as whether or not the beard does, in fact, harbor bacteria, do go ahead and tell us. I will say this, that where my G-tube is, I have hair on my stomach around my G-tube wound. So not only do I have a tube in my stomach, I also have hair on my stomach, which is gross. So I'm over 2.
So that...
Yeah.
So, yeah, perhaps cite a study when you comment and know that maybe it's not wise, Gunnar. Maybe your mom can back up her anti-facial hair with some
science
studies. Yeah.
That's the last thing my mom needs, another reason to make me shave my beard. I'm a beard guy. I don't like being clean shaven. That's just the way I am.
Yeah. It's the in thing right now, I think, too.
Yes, as the fashionista of the group here, I appreciate the insight.
You're very on trend.
Yes, exactly. As to whether or not I'm doing the right thing by the trends of society.
Yeah.
All right, so that was our second question. Our third question comes from another CF mom, and it asks what we think about the Frequencer versus the vest. Okay, so the Frequencer, for those of you who may not know, is a lot like the percussor, I think. Basically, we have a podcast. I'll attach the video podcast to the blog right up here so you can see what it looks like. I happen to love it. It basically, you hold it in one hand and it kind of moves around your chest, and it sends airwaves, or sound waves rather. That's why it's called the Frequencer. It sends sound waves through your chest walls into your lungs, and it loosens up the mucus so you can cough it. Up. The reason I like it is because it lets you focus on specific parts of the lung. For me particularly, there are certain areas in my lungs that I would say, worse disease than other
Hmm.
parts of the lung. I don't, who knows why that is?
Yeah, no, I have the same issue. Like the where my lung has partially collapsed is always more of an issue for me. But
Okay,
I've never
so you
used
know
the
what I'm talking about.
frequencer.
You
Yeah,
never.
totally.
Okay,
I've
so well, have you used the other one?
percussor.
Yeah.
Yeah, in the hospital, like once, I think I they used it like for my respiratory therapy during the day, and I didn't mind that. I think whenever I've needed like specific spots worked on, I've always gone back to
Just
like,
manual PT.
yeah,
Yeah, so have
yeah,
I. I mean, I can tell you, there's a number of times during college when I had my friends whack me
yeah,
and really try to
yeah, yeah.
loosen some mucus up. I'm sure they love that. But no, the
Yeah.
frequencer. I think the frequencer gives me the ability to do that though by myself.
Right.
I mean, I'm definitely a big believer in the vest. I'm not going to tell you which one is better because ultimately it comes down to what you
Person.
think works for you or your child. It's one of those things where it's a little bit of trial and error. There's everyone's a little different here. So,
Well, and perhaps like you said, for different uses, you know.
exactly, and there are ways to get both of them through insurance. Obviously, it's not going to happen the same year. Maybe you go with one, this year, and then you go with another 5-6 years down the road when the insurance
Hmm.
is ready to re-up you.
Yeah.
Or maybe not even 5-6. Maybe it could be like 2 or 3. Depending on your insurance policy. Yeah, I think the way I did it was I had the vest for many, many years, and then the Frequencer came along, and that's how I got my hands on it. I think I was in a trial for the Frequencer, actually, now that I think about it. Although I don't know. It was a while ago. Yeah, somehow I had it for like a month trial or whatever.
Oh well.
And then they ended up letting me stick with it.
Well,
But
now
no,
I'm gonna look into it.
I will say this, though. It's very easy to travel with. It's probably, I don't know, a third of the size of the vest.
Wow.
It's very easy to carry on the plane.
Yeah,
It fits comfortably into the overhead.
that would be.
Whereas the vest is a little bit more of a tricky situation to get on to get in the little compartment
Yeah.
up there.
Well,
But yeah, no, I mean, listen, I think if and then most clinics they will give you the opportunity to try things, right? So if your
yeah.
clinic is offering a trial with a Frequencer, what do you really have nothing to lose to try it, right?
Yeah.
So it's definitely a good thing to at least try or maybe get your hands on. It's really I'm not going to tell you what to do. I'm not going to tell you one's better than the other. I will say I use the vest twice a day, and then if I am traveling or if I'm in a situation where I feel like there is a problem area where I'm trying to move a plug, when I say a plug, mucus from a specific spot inside my lungs, then the Frequencer is the go-to. The vest I feel
Yeah.
like is more of an all-encompassing treatment.
Right. Every day.
Exactly,
Kind of thing.
it just does the whole thing.
Yeah.
It gives you the opportunity to have cough and stuff like that.
Yeah.
But no, there are some benefits to the Frequencer, but the vest, I think, the vest is definitely the bread and butter of CF care.
Hmm.
I mean, for as long as I can remember, the vest has been available. As much as I hated it when I was younger, the vest is
Oh, I
definitely.
loved it.
Really?
Oh yeah.
When did you start using it?
I was six.
You were
6 years
6 years
old.
old when you started using it.
Yeah.
Oh.
Yeah, I loved it. I I would do like bah, like a little lamb. Like I thought it was the coolest thing ever when we first got it. And I started to nap with it. Like I would just pass
Oh,
out
really?
while
I could never.
while
Play
I was
that.
feeling the vibrations. Yeah.
Actually, funny you say that because whenever I have it on, my friends fall asleep to the noise of
It's
it. Yeah,
soothing.
they think it's
Yeah.
like a white noise sort of thing. It puts all of them to
Hmm.
sleep. Every single one of them falls
Totally.
asleep to it. And in
Totally.
college, it was like a big fun thing for all my friends to try.
Try. Yeah,
They were
yeah.
like,
I have
"Oh, let me
videos of
try
my
that
friends.
thing on. It looks so cool." Yeah, it is cool, man.
Yeah.
Whatever. But yeah, so that's my experience with the vest and the Frequencer. Definitely, if you have the opportunity to try both, do it. I mean, at the end of the day, it's all about having the right option, right? You want to have
Yeah.
options for yourself. You don't want to pencil yourself into one thing specifically and then find yourself stuck there. I think you really want to be able to. I don't know. You want to be able to
Figure out what works.
exactly figure out what works and what doesn't, and the earlier you can do that, the better.
Absolutely.
All right. So the fourth and final question for this mailbox episode comes from a Facebook message, and it asks how Julie and I deal with CF being an invisible disease.
Yeah, that's a great question, and probably multi-pronged, and we can most likely circle back to this one because I feel like there's so many different ways we could go with this. But I mean, in some ways, I think it's great that it's an invisible disease in the sense that, no one, when you're just walking outside or with your friends, it's not like anyone's going to really realize that you're fighting this, right? But then I guess that's the other aspect of it, is that I think some people end up frustrated that people don't realize like that famous saying, everyone is fighting a battle, like you'll never know what they're fighting at home. So I think that's probably where the frustration lies, that it's an invisible disease. It's always funny to me when, especially around the holidays and the cold weather changing, family members are fighting colds, and like to hear them complain about it. And I'm just like, this is like every day.
Yeah. No, I hear you. My mom and dad both had a nasty cold the past couple weeks, and they were like, they're like, man, this is miserable. And then I was like, just sitting there, and I was like,
come on.
And they kind of looked at me. I was like, no, it's like I sympathize with people. Like feeling sick and having a cold is like the worst thing ever. So I can sympathize. Totally. It's not like I'm a stone cold person over here with no emotion outwards. It's okay. You're sick. Like you don't feel good. It's all right.
Yeah.
You don't have to
No.
You're allowed to complain. It's okay.
Yeah. Well, and I think I actually think that that's a benefit of CF, is our perspective is so much greater. It's like, yeah, well, first of all, if we went around complaining about the daily burden, we'd be pretty miserable all the time.
Yeah, no, I think when with the invisible disease, there's two ways to look at this. We have every reason in the world to complain, but I do think, why would we waste our energy in doing that? Because it's one of those things where it's like, why would you waste your time to do that when you could positively channel your energy elsewhere?
Yeah.
It takes effort to complain, and I think a lot of us don't realize that. And it's really one of those things where you're like, what the hell am I doing here? Why am I even complaining? Why am I?
Yeah.
Why am I so upset at the world? There's, at the end of the day, it just happened, right? There, you didn't.
Yep.
You weren't chosen to have CF, or you weren't. No one's giving you CF as like you were bad in a previous life or something. Like,
yeah,
give me a break.
Just happened.
It's like it just happened. So I think, there are some pros and cons to the actual concept of the invisible disease, and one of those is, you do tend to be treated like a regular person, and I prefer to be treated that way. I don't want a pity party all over the place, but at the same time, you do get some criticisms in really weird situations. I have a handicap thing on my car that I really try not to use unless I'm really sick, and it's one of those things where. My parents are always fighting with me. They're like, Gunnar, you have the handicap thing. It's there for you, and like you're deserving of it. But at the same time, I have had some pretty uncomfortable situations with people being like, oh, you're not a handicapped person. Like this is for it's supposed to be used for someone, and you kind of have to just blow those off, and you're like, all right, man, whatever. Just you have no idea. Don't worry about it. But there are two sides to this argument, and I think some people do struggle with it, where other people are just kind of like whatever.
Yeah. I think I remember when I was in the hospital and during one of my partial lung collapse spells, it was my first week in the hospital, and one of my uncles came to visit me, and he walks in the door and he's like, well, you look great. And I was like, that's the last thing I want to hear right now. So I think
I don't feel great.
I am here for a reason. So I think that is that can be part of the negative too, is like when people constantly tell you, well, you look so good, and you're like, well, my sinuses would tell you a different story, if you could see inside. So I think that is a real struggle that that people have, and I've certainly faced. So I think there are pros and cons to the invisible disease, and you just kind of, it is something that kind of just comes with the territory.
Yeah, and it's one of those things that really, I don't think you can spend a lot of time thinking about it. But as far as like a strategy that I use to get over it, it really comes down to the fact that it's the life that you're living, right? So you have to, as soon as you come to grips with that things aren't going to change overnight. You know, we're not going to wake up tomorrow morning and all of a sudden be free of CF. You know, that's just not going to happen. It's unrealistic. So I do think that there are moments in life when you have to realize and you have to accept with what you're dealing with, how things are going, you know, things like that. And as soon as you can confirm with yourself that you're dealing with something that most people are not, in fact, a lot of people are not, you really just stop feeling sorry for yourself. You know,
Yeah.
As far as I'm concerned, I stopped feeling sorry for myself when I was 2 years old because I've known nothing else.
Yeah.
You know, I definitely deal with frustration and anxiety like we've talked about, but that's different. That's just, I think, because I'm a motivated go-getter kind of person, and I do feel like that sometimes the CF gets in the way of some of my plans. But as far as dealing with what other people think about me because of my CF, that's like a sticks and stones may break my bones sort of thing, you know?
Right.
But words will never hurt me. You know, it's true, but you know, you do hear the words, and people are out there talking about it, and you know, people are you cough, you're on the train and you're coughing, and then all of a sudden people want to move away from you. You get used to it.
Yeah.
But at the same time, is it really that big of a deal?
Yeah. And I actually like have a little mental trick that I do myself when those things happen, you know, whether it's wearing the mask, because wearing the mask for me for a while was something to get over, especially like when I was really young and in the hospital and other kids would make fun of me. And it was just something that I came up with in my mind, like, well, you have no idea. Like, it was like almost making it like a positive thing, you know, and like let them move. Okay. Like, you know, it's almost like a little secret, you know?
Yeah, no, I totally agree. I was actually, I was on the train last night coming home from the Rangers game. And the train just happened, like the game went over, so I ended up missing the train that would have been less crowded, and the train that I ended up getting on there was like standing room only. So I have my mask on, obviously. It's flu season in New York. It's, you know, I can't not wear the mask on a train like that. So I'm wearing it, and then finally some guy just like, you know, it's one of those things where everyone's like crammed like sardines in the train. Mm-hmm. So some guys finally asked, he's like, do you ever get like sick of people like giving you weird looks for wearing the mask? And it was kind of a weird thing to ask. And I was like, nah, man, like, you know, it just, you kind of just get used to it, I guess. And he goes, oh, but then he started telling me how he worked in medicine and all this stuff. And I was like, yeah, I mean, at the end of the day, yeah, people are going to give me weird looks, and that's going to happen. But would I rather that or get the flu? You know, and then have the flu change my life forever? Yeah. You know, at the end of the day, you have to balance that. What is more important in your life? And I could care less if people are giving me a strange look because I'm wearing a mask on the subway train.
I wish I could remember which philosopher it was, but some philosopher used to go into town purposely dressed crazy, like to embarrass himself so that he built up the mental capacity to not care, like what other people thought of him. And I just thought that was a really interesting, like, there's such a parallel between, you know, wearing the mask or, you know, I've done my nebulizer in the airport, you know, and get weird looks, like just saying, all right, like that's your problem, not mine, if you're looking at me weirdly.
Well, it's like those people with CF who have to wear oxygen out on the street. You know, that's a whole other thing. You know, there's, you know, how frequently do you see somebody 25 years old, 25, 30 years old wearing oxygen, like walking down the sidewalk? It's a pretty uncommon thing, but, you know, at the end of the day, you got to live your life too. So, I think it's one of those things where, you know, unfortunately, you have to get over it. You know, there are some difficult things, but you can do it. I mean, you have to find it within you to sort of get beyond some of the struggles that come along with it.
Yeah, that's what other people think is something you can't take on yourself. Yeah. Obviously, I mean I think it's important. It's important to build a good reputation for yourself, but at the same time, you don't want to have the outside world bringing you down. Right. Yeah. I think it's a good way. Or making you unhealthy.
Oh yeah, exactly. I mean,
Case of the mask.
yeah, exactly. So that's my answer to the invisible disease topic. I'm sure we'll come back to that because that's something that's definitely discussed pretty broadly. And it's definitely, I think it's an important topic. It's also one of those things like mental health that's sort of overlooked in a lot of ways because when you're growing up with something you're dealing with it every day, it's just second nature at that point.
Right.
All right, so we're going to move on now to Making It Matter. And our Making It Matter person this week is Caitlin O'Hara, who made national news leading up to Christmas time with the hashtag Lungs for Caitlin. Caitlin and I have a lot in common. She went to Boston College, and she has CF. But she did spend a long, agonizing time on the transplant list before finally receiving a pair of lungs. However, they just came a little too late. She passed away a few days after getting a second shot at life. Caitlin will be dearly missed by the Boston College community and the CF community. As I know, thousands and thousands of people were following her progress and her wait for lungs. Caitlin was 33 when she passed away, far too young for such a great person. But her story was one of certainly courage and miracles and a lot of really great things coming out of such a sad time for her and her family. So please keep her family in your thoughts. And Caitlin, you will be missed.
Absolutely. And she had a beautiful essay. I think she did a couple of blogs you can link to on this post, Gunnar.
Yeah, I'll definitely link to the blog. Her and her mom sort of ran a blog as she was progressing down the transplant list. So, Caitlin, breathe easy these days, and we're all thinking about you. So that's all the time we have for today. Thanks for tuning in for the 20th episode of Making It Matter. I can't believe we're up to 20 so far. Remember, you can follow along with our weekly podcast via my YouTube channel on GunnarEsiason.com or JuliaRay.com. And now you can subscribe to our podcast on iTunes. So do that, and give us a favorable review because we want to climb the iTunes charts. That's what we want to do. We want to take over the iTunes podcast charts. Favorable review.
Yeah.
Get it done. Making It Matter with Gunnar Esiason, Julia Ray. And if you want to, and Instagram. You can follow us on Instagram too.
Oh, yeah. Oh, the Instagram went on a holiday hiatus, but we're coming back, I promise.
if Julia ever gets her hands back on Instagram. So hopefully she can do that. And if you want to see us podcast about something specific like we did today and our past couple episodes, you can always send us an email at gunnarsblog@esiason.org or Julia's email, which is
JuliaRay@JuliaRay.com.
And then you can send either of us a message to our Facebook pages or our Facebook fan pages, whatever they're called. We like
Twitter.
Yes, Twitter
anything.
and YouTube. And we had a YouTube question today.
Yeah.
It's a new one.
Cool.
So definitely get a hold of us because we like to talk about what you want us to hear. You know, we can Julie and I can be up here and we can pontificate all we want, but we want to talk about what you want us to talk about. So definitely do that.
Yeah, we love hearing from you, so let us know what you want to hear.
All right. Well, this is Gunnar Esiason and
Julia Ray. Have a Happy New Year.
Yes, Happy New Year, everyone, and we'll see you in 2017.